Hi, I'm Tim Williams, lead trial attorney here at the firm. You know, it's not uncommon for us to deal with clients who have had to undergo hip replacement surgery. And sometimes that's due to the fact that they have such acute traumatic injuries that they can't repair the bone in the hip or the hip girdle, and it needs to be replaced. Sometimes it's because the person has some level of degeneration and a traumatic event made that active, in other words, activated those symptoms, or if they already had some symptoms, made it so much worse that their only option at that point is hip replacement surgery. Under any of those scenarios, that person is entitled to recover for their injuries, their damages, their surgical costs under Oregon law. But what I'd like to do in this video is explain and illustrate what exactly goes on during a hip replacement surgery. So to illustrate what goes on during hip replacement surgery, I think it's best to look at the anatomical model. So here we see a diagram of a person's hip. This would be their left hip. And we start taking away some of the tissue, the outer tissue. Now the skin and the fat's been removed. You can see there's the lumbar spine, there's the sacrum, and here you have all this musculature that's still attached to the hip itself. So, you know, when a doctor has to go in and do the surgery, they're like slicing through all that stuff. They're moving as much of it out of the way as they can, but inevitably they have to slice through some of it. So, you know, the surgery itself is not the most pleasant in terms of the recovery period, but sometimes it's your only option. So we continue working our way down. We take off some more muscle. We take off even more muscle. And now we're down, all the muscle's gone. We still see a lot of nerves in there. So the doctors are not only, and this is impressive here in a minute because when you see what actually goes on, to realize they're trying to work around all this connective tissue, the nerves, the muscles that are there, is pretty impressive. So we continue on our way down, and then we take away a lot of the ligaments. We take more of the ligaments, and now finally we can see the hip socket itself. And you can see here's the femur or the leg bone, this is your thigh bone. It kind of jogs, in the case of this side of the body, the left side of the body, it jogs inwards as it goes into the hip socket itself. And this is in your hips, there's a joint in there, there's like a cup, and that's the ball. So this is the ball and socket joint, just like your shoulder. So the ball in the leg bone goes into the cup that's in the hip itself. So what takes place during hip replacement surgery? So again, there's the ball and socket joint. We have, pause it there for a second, all this white here we see that's surrounding the ball as well as lining the interior of that socket. That's this nice fluid, well, not literally fluid, but it's this nice slick silicone-like substance. It's like Teflon really. And what it does is it creates a nice smooth gliding surface. That substance can be ripped or torn through trauma, such as a high-speed event, car crash or whatever. It can also become subject to injury or more prone to injury due to natural aging and the thinning of that material as we get older and we continue to use that joint. So this video here is going to focus on the second of those situations, the aging process, and how that leads one to be more susceptible to developing symptoms and ultimately undergoing the surgery. So now we see during the aging process, a lot of that material, that Teflon-like material, is now gone. Okay, so it's been worn away, or in the event of a traumatic event with a younger person, it has been torn away because of the trauma to the hip. But in any event, it's now gone. It's no longer as cushiony as it used to be. Okay, so a lot of that material is gone. The ball of the socket is now ball of the joint is now further into the socket itself. Okay, so there's less room in there, there's less gliding surface that's available, and you're getting some bone-on-bone action, which is incredibly painful because there's a lot of nerves in the bone. There's no nerves in that tissue really that otherwise would be allowing the gliding action to take place. So looking at this, again, some people can have some continued degeneration. You can get a little bit of bone spurring in there. Bone spurring just aggravates the situation, and it makes it worse, more painful, because now you're having these bone ridges. Not only is the ball in the socket itself lacking that gliding surface, but now these ridges on the bone can actually catch the ridges that are on the opposite side of that socket, and it create additional pain. So here's what the doctor does, or the surgeon does. They separate as best they can. They separate away the ball portion of that joint from the socket. Now they just remove it completely. I mean, they just cut the damn thing off. And then it's a little bit fast. And then they They smooth the interior of what used to be what still is the socket, but they smooth that out, so they're getting rid of all that decayed and fractured surfaces. They're getting rid of what's left of the smooth gliding surface, and they now drill a hole into the femur or the upper leg bone. All right, and then they use this device to create a specific pattern in there. So you can see it's long and it's shaped, and then you have this rectangular shape at the top. So that it's going to actually sort of make that, it's like a little cave, okay, and make that particularly shaped cave within the bone surface itself. And then within that particular, it's shaped particular for a reason, because you can see it. This device here matches the same shape of the device you just saw that made the hole. Okay, so now this is going to go inside of the bone, and then that's going to be secured in there. And then they're going to screw the cap or the top, the ball portion of that socket to the top of that. So now this becomes a replacement for what they removed, and you can see it's nice and shiny and it's metal. So it's refurbished in a sense. It's no longer doesn't have the problems that the natural bone there had. Now in the socket itself, they're going to insert this additional piece inside. They're going to secure it with screws. We'll see here in a second. And then what they're going to do is they're going to use this. This is like sort of like a Teflon type material. This is going to be the smooth gliding material that's essentially replacing that which was lost in the natural bone. Okay, so that's going to be put into place there inside the socket. And then what you're going to see here is that this is how the bone attaches. Remember, you just saw them slide that piece of metal in? Well, this is how it stays in place. The bone itself is going to grow into the jagged, roughed up surface of the metal itself. So it's going to actually connect to the metal itself through the healing process. So the bone extends up and in, fills in the spaces. It's now permanently secured to the metal. And then the socket, that actually takes place over time, but the socket is put back into place, obviously, in the operating room. The ball is put back in the socket. And there you have a fully functional hip. Doctors are fantastic at this approach. It's a surgery that years and years ago was much more complicated, had higher risks of complication. Now they've got it down to a science. They're fantastic, and I wouldn't be afraid to get the surgery done if you needed it. Again, it's no joy, but at this point in time, you're up on your feet doing physical therapy within days of the surgery, whereas before you would be in bed for weeks. So it's real important when you have the surgery to get up, follow your doctor's orders, follow the physical therapy specialist orders, because the more you move, the earlier you move, the better your recovery is going to be, and the shorter recovery period it's going to take to get you back, literally back on your feet and active again.
If you've been injured and need help, Dwyer Williams Charkoss Attorneys will get you the settlement you deserve. Experience gets results.